Well, thank you. And so another painful afternoon for the audience, I believe. But then I always keep wondering as to why why does spirituality sessions always uh, why does it get an afternoon slot, you know, and a post-lunch slot? But anyway, uh, uh, that is probably because spirituality is probably seen as something which is okay, we can do without it. That sort of attitude perhaps is still there somewhere lingering in the back of people's minds. But then believe me,
Can
but
I
then believe
interrupt?
me, yeah, please.
Like currently we are making all the sessions in afternoon, sir. Afternoon
Okay,
only.
great. But in general, in various conferences also I've seen, usually these things take a backseat. Uh, but let me tell you that the things which we'll discuss today definitely hold a huge value for providing comfort to the patients and their families also. Uh, so, so anyway, let's begin. And so whenever two humans meet each other, or whenever we go to any place, what do we look for? We look for commonality, isn't it? We try to find out what is common between us. Like if you go to Canada, for example, and there if you find an Indian, you would be thrilled to meet that Indian, because that person is also from India. And then when you on further questioning, we find out that he's actually from Kerala and you are also from Kerala, so that gives an added bonus for you, right? So as human beings, we always look for commonality so that we can relate to each other, right? So spirituality is something which binds us all. Religion may not bind us all, because we may follow different religions, or we may be non-religious for that matter. But then spirituality is something which all of us have, and that is one thing which binds us together. So if you just spirituality, if you don't remember anything at all about spirituality, remember that is something which binds us to all other living beings, because that is a commonality. Well, coming to the nature of suffering, illness is a spiritual event, right? If you remember all the times when you were ill, or all those times when you were actually hospitalized also, if you were not so fortunate to be treated at home, if you are hospitalized also, so all those events, whenever we face a life threatening event in our life, or such a event which leaves a deep impact back in our minds, that we seek uh, refuge, right? We seek a source of refuge, and that source of refuge can come either by religion. We can take refuge in God, for example, or we can take refuge in something which gives us a sense of meaning and purpose. Like we can take refuge in our family, we can take refuge in our mother's lap. Remember all those times when you were a little child and you were ill, and you would lie down in your mother's lap, and your mother would gently, roll her fingers through your hair. And that would be the best pain relief and the best relief for fever. It would beat paracetamol at any day. So illness is a spiritual event. It grasps person by the soul and by the body and disturbs them both. It raises troubling questions of a transcendental nature about meaning, value, and relationships. And so you see, illness, you might say, oh, God has been very bad to me, God has punished me by giving me illness. But I would say that, look, God has actually given you an opportunity. God has actually blessed you by giving you an illness, because now that you have that illness, you have a different outlook to your relationships, to the world, and everything. It prompts you to think. suffering in any manner is a challenge, and we need to keep on evolving rather than being just flooded down by and drown in our sorrows. If you take your sorrows and your suffering to be a stepping stone for your success, so that is how the that is how a complete human being is born, actually. So that is the whole meaning of suffering, the way how you look at it, how you look at any piece. Like if I give you a chapati and if you say, oh, you have just given me a dry chapati, I won't eat it. But if you give that dry chapati to a very hungry man, he would relish it like a 5-course meal. So the value of that chapati would vary from person to person. So suffering has the same effect. Now, the question arises, which we often don't want to address, is that will we die in a manner consistent with the way which we have lived, which respects our personal values, spiritual beliefs, cultural background, and preserves our dignity? Or will we die a lonely death? So that is another question. And all those terminally ill patients, be it those suffering from cancer or be it those suffering from some other disease, at some point in their life, they would be contemplating on the way that they would finally die. And often people, most of my patients whom I have interacted so far, most of them are scared of dying alone. But then who exactly in this modern world of ours, in this lovely modern technological marvel of a world which you call nowadays, who is going to sit by your bedside? Who is going to provide comfort to you in your last days of life? Your wife, your husband, your children? So think about that, and then you will understand the values of spiritual essence. Now, if you look carefully at this photograph, what you would see is this gentleman in the striped shirt. He is giving a glass of water to this gentleman who is sitting on the bed. That elderly person is the father, and the gentleman with the striped shirt is his son. And the father is having advanced cancer. And this lady sitting in the foreground and offering a bowl of water to this gentleman is his daughter-in-law. So he was being taken care of at home itself. In his last days, he was spending time at his home, in the comfort of his own home. And what if you look carefully at the background, you can see 3 pictures, out of which one picture is that of a god, and the rest 2 pictures are family photographs. So this gentleman, this elderly gentleman, he knows that his days are numbered. So in his last days of life, he has kept only those 3 photographs. And those 3 photographs give him a sense of meaning and purpose. He has resorted not only to religion, but also to connectedness with the family. Because the family is what gives him a sense of meaning and purpose to his life. So here in this photograph, you can see a connection between the patient and his family. That is the spiritual satisfaction which is getting by the connectedness to his family, and his religious connection by the figure of that God. So he's not only connecting in a spiritual manner with his family, because that is what is giving him a sense of meaning and purpose to his life, and also he's seeking support from the divine by religion, by means of religion. So here you can see this is a beautiful example of both spirituality and religiosity coming in to heal a patient. Now, healing, you wonder, heal? How can you heal this patient? Healing is different from treating. What the doctors do is treat you. They give you medication so that you will be free from a disease temporarily. Because even with modern science, we hardly can actually completely treat chronic illnesses. We can't treat chronic illnesses. We can only palliate chronic illnesses, right? So healing is something which we should all learn to do. That is treating a person not only as a patient, but as a gentleman or or as a lady, as a person, right? Addressing not only his physical, but also psychological, social, and spiritual issues. And that is the power of healing. When you treat the person as a whole, here you are not concerned whether the person will be cured of the disease or not. Healing is a thing of the soul. It is a thing of the spirit. Whereas treatment is a physical thing. It is only limited to the physical body. Healing comes from the mind also, whereas treating is again limited only to the physical body. So I leave it upon you all who are listening. So 22 participants now. I leave it up to you whether you want to be a healer or a treater. It is seldom a medical man has true religious views. There is too much pride of intellect. And so very true. Once you have dived into the field of science, you think that you are a Superman. You think that all other branches, all other arts, all other specialities are absolutely useless. You only focus on science and technology. You look down upon other things. And that is not the way things should happen. The physician's own belief system, whether spiritual, religious, or none, affects medical decision making consciously or unconsciously. And this is so very true. The way I would treat a patient, me being a believer, me being a very spiritual person, and say another counterpart of me, who is a non-believer, who looks down upon religion and spirituality, the way he would treat would differ. Right? So, when you choose your doctor, when you choose your decision maker, that decision maker who will take the final decisions as to how and where you would spend the last days of your life. So, choose your doctor wisely. Would you like to spend the last days of your life in an ICU, hooked to a ventilator, your hands and feet tied to the railings of the bed, and the last time when your eyelids flutter open, all they can see is the face of a doctor or a nurse or a sweeper? When your family is just 20 feet away, but they are not allowed inside because it is not the visiting hours. So that's why I say it's very important that you choose your doctor wisely. Just don't look at his qualifications. They don't mean anything. Education and reading are totally different things. Education is not only about reading and passing exams. A truly educated person would look at life in a holistic manner. Right? So, as far as you all participants are concerned, this is a very strong piece of advice that I would give you. Choose your doctor wisely. What would you want in your doctor? What qualities would you look for in your doctor? You just want technological advances? Fine. You want a complete human being addressing you as another human being, respecting your wishes? That is another choice. And the choice lies unto you. Now, this photograph is a very ancient photograph. This is the Varaha avatar of Vishnu in Hinduism. And this photograph would be at least 5, 6, 7,000 years old, if not more. And what this Varaha avatar is doing is basically lifting the earth, the globe, on the snout. Right? You can visualize it. Now, the Western world actually proved that the earth was spherical hardly 200 to 300 years back. But you see, our ancestors, they knew that the earth was spherical more than 4,000 years back. what I want to say is that we should learn to respect all other cultures, all other systems of medicine also. Things which we don't have an idea about, we should not just simply, foo down at it. Everything should be viewed with respect because we are ignorant of so many things. What we see as light is just 2% of the whole light. That doesn't mean that 98% of light is missing. That 98% of light is also there. The only problem is that 98% of the light is not visible to the naked human eye. But it is there. It exists. So just by seeing that 2%, we should not get biased and we should not form our opinions. It's a grievous mistake to keep a wall of separation between medicine and religion. There is a division of labor, but a unity of spirit. The act of healing is the highest form of imitatio Dei. As I told you, it is all about healing and not treating. So there is a difference between treating and healing. Now, this is a favorite photograph of mine. I show it in almost all my talks nowadays. The day after this photograph was taken, it bowled me over. What you can see is a rural setting in which this lady who is lying down on the charpoy, here, this is the lady, she is the patient, she is dying. And just a few hours after this photograph was taken, she passed away. And this lady who is offering her a last sip of water is her daughter-in-law. And this gentleman in the dhoti, that is her husband. And these are all the family members, extended family members who are sitting. And this is our palliative team also is sitting out here. And you can see the rays of the sun gently streaming in. This is a beautiful way to die. Surrounded and loved for by the family, by things which really matter to you. All those visions which you would like to see finally before your eyelids shut down forever. So it's a choice. It's a choice. It's a voluntary choice which all of you can make. Where do you want to die? Where would you like to die given a choice? And this was another lesson which this little girl taught me. This little girl, you can see her arm used to be swollen by, she had an sarcoma, very aggressive sarcoma growing in her arm. And her mother would bring her to my clinic. But every time she would just stare down at her feet. She would never look up at me. So unconsciously, she was sort of bracketing away me from the whole conversation. And one day I decided, no, today I'll definitely speak to her. And so I brought her this huge box of chocolates and gave it in her hand. I sort of bribed her. And after a long time, she finally looked up at me. And that was the day, I still say that was the day I saw God in her eyes. Her eyes were the most beautiful and expressive eyes that I've ever seen till date. And then when I started talking to her, I asked her as to why do you cry so much? Does it hurt you? Does your arm hurt a lot? And then she told me that no, when I look at my mother crying for me, that is the time when I feel so sorry that I start crying. So our own perceptions of somebody else's disease might be so wrong. And all the while I used to keep thinking that, oh, maybe my medications are not sufficient enough or good enough to control her pain. And she just used to sit very quietly. And you see how wrong I was till the day that there was an effective conversation between us. She was more concerned about her mother's suffering than her own suffering. And that was a great lesson that she taught me. Now, religion comes from the Latin word religare, which means to bind together. So now there are 24 participants in all listening to this. So if 24 of us now sit down and we decide that, okay, we will form a group and we will call it XYZ, and this XYZ group will pray to such and such a figure, and we will form our set of rules. So then we will, at the end of the day, we form a religion. So religion is basically a man-made thing. That is group of people with common thoughts and ideas. They come together. It's a structured belief system that addresses universal spiritual questions. Religious rites and rituals provides a concrete way of expressing spirituality. It is group-based, corporate-based, structured, organized. There are certain rules, regulations, what to do, what not to do, when to do. Everything is written down. Right? So that is religion. So then what is spirituality? So there are many definitions, and even in 2012, there was an international consensus definition of spirituality. But for me, spirituality is what gives you a sense of meaning and purpose in life. Anything which gives me a sense of meaning and purpose and a sense of connectedness to life, that is my spirituality. Today, if I like listening to music, I live music, I love music, I eat music, I sleep music. So spirituality, that is my spirituality today. And the best thing about spirituality is that tomorrow my spiritual values can change. Tomorrow I might fall in love with a woman, and she might be my spirituality for some more time. And then one fine day when that lady would kick me out of her house, and then I would go looking for spirituality in booze. So then I would keep on drinking liquor, and then liquor would be my spirituality. So spirit being my spirituality, actually, great thing. So that can continue. So the best thing about spirituality is that it keeps on changing, right? Spiritual issues often surface during end of life, or whenever you face big challenges to your integrity. Whenever there is a threat to your integrity, then we seek support in terms of spirituality. So not all are religious. You might not believe in a religion, that's fine. You might be an atheist, that's fine. But all of us are spiritual. All of us have that ingrained. So that is our ingrained, inbuilt software. Whereas religion is that extra chip which you add on. Those are extra downloadable, softwares which you apps. But spirituality is inbuilt in us. All of us are spiritual. So this gentleman's main concern was that it was a spiritual concern. It was an existential concern. That who is going to light my fire? Now my son has fought with me and he's gone away. So then we went and talked to the son, and we made him reconcile, and then the father and son met together, and then his quality of life could be restored. Now, religion and religious traditions serve two main prime functions: provision of a set core of beliefs about life events, and establishment of an ethical foundation for clinical decision making. Because many times in palliative care, we come across certain areas where we are forced to take certain decisions, and those decisions are very tough to take, scientifically speaking. So here, in such situations, religious beliefs and practices can often help us in arriving, not only help us, by us, I mean the doctor, the patient, and the patient's family, to help them arrive at a clinical decision. Now, what is the role of religion? Religion helps in coping with stress, right? It acts as a buffer against depression, speeds recovery from emotional disturbance, associated with positive emotions, related to lower rates of alcoholism, drugs, crimes, better school grades, actually related to healthier lifestyles and fewer risky behaviors, lower rates of hospitalization, actually, greater marital stability, means few divorces, enhanced family relationship, more social support. Now, this gentleman, Harold Koenig, he actually published a paper in Gerontology in 1999 where he said that older adults, this was done primarily in a Western culture, in a Christian community, this study was done. Older adults, particularly women who attend religious services at least once a week, appear to have a survival advantage over those attending less frequently. And this was highly significant statistically. That means that they found that people who regularly attended church, right, had a survival advantage, means they actually lived longer. This is what this study found out. And people who are religious, one study found that they had less stress-related medical conditions like cardiovascular accidents, strokes, hypertension, etc. They actually had a greater longevity, 7 to 10 years of additional life, which is very significant, isn't it? And lower mortality. And actually, people who are religious, they have a slower progression of cognitive impairment, that is, lower incidence of dementia. And they have lesser functional disability with aging and faster functional recovery after surgery. Well, these are some of the studies which have shown these advantages. Now, there is a term called religious coping, right? See, many times you are all very conversant with religious coping. See, whenever you, before the exams, we start running to temples, churches, and mosques and promising God, right? We try to, entice God to help us pass the exams, bring good marks. So all of us have gone through it, isn't it? We start praying whenever we are in suffering, isn't it? We need help. We need help from the transcendental sphere. So we are all very aware of religious coping. Now, what is the flip side? Till date, no research has shown any correlation between quality of life and patient-reported religiousness like religious coping. Religious struggle was associated with increased risk of mortality in medically ill elderly patients. That is, in elderly patients, if you feel that God is punishing you for your mistakes and all, here actually there was an increase in mortality. Greater religious and spiritual needs associated with poor patient psychological quality of life. So if you feel that, no, I need religious counseling, I need spiritual counseling more and more, then you have a poorer quality of life. And high religious coping, people who were who strongly believed in God and felt that God is going to help them, they opted for more aggressive end-of-life care during their last days of life. So this here again is a way of coping. I was helping this lady cope with her religious struggles during her last days of life. And coping could be in many ways, by celebrating life. Here you can see this is our hospice, and we had a spiritual session for the elderly. And here you can see they are celebrating life. And here again is another example. You can see this lady who is holding up that little child. That little child is the granddaughter of that lady. And this lady, if you see her stomach, there was a large ovarian cancer. And you can see edematous legs. She had come down all the way from Tripura to be with her daughter. This is her daughter. Her daughter was pregnant at that time. So because she wanted to hold her grandchild before she died. So that was again her spirituality, isn't it? She wanted to hold her grandchild in her lap before she died. So with good palliative care, we made it possible. She could hold her grandchild in her lap. And a few days after this photograph was taken, she passed away peacefully. So this was an example of a spiritual pain or a spiritual distress, which was tactfully managed, right? She could achieve the goal. So all of us, all human beings have universal spiritual and existential needs, the need for love and authentic connection, the need to understand and transcend suffering, the hope to find refuge or a source of peace, and the need to find a meaning in life. Now, there are certain areas or behaviors that erode patient dignity, like relationships of inequality, treated like an object or without respect, because everybody, you see, everybody has their own dignity, isn't it? It's all about dignity. Or if your wishes are not honored, or loss of control over bodily functions, would you like it? Because at some point in your life, maybe you will require assistance with your activities of daily living, like going to the bathroom or washing yourself after passing feces. So who is going to do it for you? Have you ever thought about it? Right? Because there is a very, very high chance, right, that you would need such support. The loss of ability to choose. And that is why advanced directives are so important. You have to put in your advanced directives as quickly as possible. Dying in pain, dying alone, dying in isolation. Would you like that? Loss of meaning or purpose, where there is a spiritual pain, spiritual distress. So how and when would you start suspecting? What are the characteristics of spiritual suffering? When the patient keeps on complaining of pain, constant and chronic pain, you are giving the best possible medications, you're changing medications, but then the patient keeps coming back and is saying that, no, doctor, it is not working. I still have pain. I don't feel like, doing this or doing that. If there is insomnia, the patient can't sleep, withdrawal, depression, guilt, self-loathing. They feel that, oh, I am a very bad person, and that is why all this is happening to me. If there is a conflict, that patient constantly fights with everybody, he doesn't want to listen to anybody. A sense of hopelessness, lack of sense of humor, unforgivingness. He doesn't want to forgive anybody. Despair or fear or dread. So whenever these features are there, one or multiple features, you need to suspect that your patient is perhaps suffering from spiritual pain. So, as I said, who exactly is going to look after you in your last days of life? Because one or the other partner is going to pass away early, isn't it? And if you are relying on your children to look after you in your last days of life, then I would ask you to reconsider your practices again, because you can't expect them to do everything, right? They have their own lives. And this was an example of an elderly couple. This gentleman is now blind. Earlier, he used to take his wife. This is his wife, and she has severe arthritis. And when he could see, he used to take his wife to the washroom. But since he became blind, totally blind, he himself could not see. So where would he take his wife to the washroom? So his wife used to sit on this charpoy, and you can see the holes out here, and she used to just pass urine and feces through these holes only. Because all these people, these are the villagers, they are not related to the family, and they have only come to see us because our home care team had gone to provide assistance here, and that is why the villagers had come. Otherwise, they will not come regularly. So the principles of spiritual care. Spirituality is an essential component. I said it is a built-in software. It is an ongoing issue. So readdress it over time. So today, whatever spiritual issue or spiritual pain is, or the source of spiritual pain is there in a person, 10 days down the line, that can change. So you need to keep on readdressing it. Demonstrate respect for patient values, autonomy, vulnerability. Do not impose, because this is the period where the patients become very vulnerable. Do not impose your beliefs on the patient. And most important is know yourself. Are you spiritually well? Right? You have to understand that you too need help at times. So understand yourself, know yourself. Physician, heal thyself. Unless you yourself are perfect, are healthy spiritually, you cannot help others. And I had begun my journey into the field of spirituality and religion, seeking various questions, existential concerns, and all since 2011. It's been a long walk for me, various places. And then we at our center at Koshish, we conduct retreat sessions on self-care also, which are attended by so many people. So what are our inherent spiritual resources? All of us have spiritual resources. For treatment of spiritual pain, you don't need any equipment. You don't need any medicines. You don't need very special qualifications. The only qualification which you need is compassion and a bit of understanding. Because all of us have the capacity for love and authentic connection, to understand and transcend suffering, to find a refuge or source of peace, and to find meaning in life. So all of us can do it. And the only qualification which we need is compassion. Here again, I used to go to Calcutta quite a bit to see patients for home care. And this was one of the patients. As I got up to take leave of her, she used to grasp my hand and she would not let me go because she wanted somebody constantly by her side. So even after spending almost half an hour with her, this was an everyday occurrence almost. This again is a picture of a young lad with rectal cancer. Very young, and he used to go to college and everything. But if you see the background, in the background again, you will see evidence of religion. The Trishul with the red cloth against the presence of religion. So everywhere and in most of the places, you will find the evidence of religion, spirituality surrounding such patients. This again here was a gentleman with advanced lung cancer. You can see his swollen up faces. He was having superior vena cava syndrome also. And he was a Muslim gentleman, right? So what I need you to focus on here is you can see the calendar. It is in Urdu. Now I have done a close-up. And although the calendar is in Urdu, but here you see some of the books which are hanging are Hindu books again. So religion stops having its meaning in its true essence when a patient approaches the last days of life, right? It becomes more fluid, right? And it converges on spirituality somewhere. It is all about meaning making. What can give you a sense of meaning and purpose in life? Sticking to religious borders no longer becomes a daily exercise. It is all about meaning making. What gives you a sense of meaning and purpose in life? Now, coming to Hinduism a bit, this is Adi Guru Shankaracharya, and he said that Jantunam Nara Janma Durlabh Mata, that is, the human birth is very durlabh, that is, it's very precious. Why is it precious? Because amongst all the living organisms, it is the human beings alone which have the power of discrimination. What is right, what is wrong. So that power of discrimination is only with the human beings. So that is why Adi Guru Shankaracharya had said that you need to cherish and make the best use of your human life. And various Hindu perspectives. I won't go into the details of religion. I'll just touch each the major religions just like that, and then there is an intersection of culture and spirituality also. Like this gentleman, he is giving Ganga Jal to his dying mother. So this is basically ritualism, right? And ritualisms are seen in every religion. And ritualistic practices uh, often offer a source of hope, often help to reduce the spiritual and religious suffering. So these are things which we should not stop, right? As long as it gives a sense of hope and meaning and purpose to the family and to the patient. In Islam also, the same thing, like what is written is that be sure that we shall test you with something of fear and hunger, some loss in goods or lives, or the fruits of your toil, but give glad tidings to those who patiently preserve. That is, that means it says that have faith in Allah, and Allah will take care of you. Allah will ensure that you are safe. In illness, seek Allah's help with patience and prayer. Increase remembrance of Allah to obtain peace. Ask for tawbah. Give more in charity, and read or listen to the Quran. Right? So for my Muslim patients, I advise that even if they can't sit up or read the Quran, somebody can read it for them. So that again gives a sense of meaning and purpose to their lives. In Christianity, sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone. And the power of God can help. Here also they say that ultimately it is Christ who is your savior, right? And you need to have faith. So this photograph was taken in Calcutta many years back, and you can clearly see that this lady is dying in the last stages of life. And our team of volunteers, and this is the patient's family, and our team went in and we started playing music. It was a part of a music therapy. And once we started playing music, this lady also, she used to practice singing in her youth. She actually started singing in her voice, in tune with the music. And here you can clearly see that she is actually smiling. And this music therapy improved her quality of life. So what works for which patient, you never know, right? So how do I do it? How do I, treat spiritual pain? First, you have to recognize the suffering. Recognizing, that is what you call sympathy. Then respond to the suffering with feelings of empathy and being a compassionate presence. What do you mean by presence? Presence is awareness and kindness. You have to be aware of the person's suffering and with an intention to relieve the suffering. And kindness, you have to be kind. Shift from doing to simply being. When you are with a patient, it is not that you have to do something always. Just be with the patient. You don't even have to talk. Just be there. Sit in one corner of the room, in the line of vision of the patient if necessary. Just be there. And the patient is happy knowing that, yeah, somebody is here who cares for me. Right? Remain available and present. Don't abandon your patients. This year, again, was another patient of mine. This photograph was taken way back in 2009. Right? So, helping the patient sleep, just a gentle touch on the head, a gentle head massage, a kind hand goes a long way. See, what we need to understand is that bodies do not suffer. The person within the body, they suffer. When physicians deconstruct suffering to its physical dimension, while ignoring the psychological and spiritual pain, they not only fail to relieve suffering, but compound it. And that is what I said about science. Science focuses on your physical body, right? So if you're just focusing on the physical body, then you cannot treat spiritual pain. So this again was another photograph. This gentleman, he's actually touching the feet of his wife. His wife has one leg amputated. She had osteosarcoma, which had spread all over the body. And this lady behind is his daughter-in-law. Now, just a few minutes back, we had broken the news to him that his wife doesn't have much time to live. And reflexly, this gentleman, his hand went and touched his wife's feet as if trying to hold on to her. He would have never done this if he had been fully conscious and aware. Because coming from North Bihar, this gentleman would have never touched his wife's feet in the presence of other people and in the presence of his daughter-in-law. But now what he did now was unconsciously, after he came to the realization that his wife had a very few days of life left. It was his own way of, just holding on to his wife. So these little pictures of divinity can only be found in the patient's own homes. You can hardly see this in hospitals. And as you near death, you can have various dreams and visions. I won't go into the details of that. And you can see the terrified look in this lady's face because she was having dreams and visions. And when we used religion to help her cope, you can see how relaxed now she can. If you focus on her face, you can see how relaxed she has become. And this was my paper regarding end-of-life dreams and visions. Of course, this is slightly out of the context. And this here was another child who was suffering from an advanced malignancy. And his whole childhood, he could not go to school because his time was spent in hospitals only. And he had a wish to go to a school. That was his wish. And we made his wish come true. We gave him a tiffin box. In the wheelchair, we would take him to school, in a nursery school, and he would sit in the last bench. And then he would sit there and eat his tiffin. And he couldn't sit for a long time, because he used to get breathless. So he would just sit there in school for half an hour and come back. But that half an hour which he spent in the school, he maximum went to school for a week or so. That improved his quality of life. And when he used to go to school, he used to make these drawings, and we have preserved some of these. So, and this is Dame Cicely Saunders, and she had introduced the concept of total pain, and she had conceptualized that spiritual pain is a very important part. So every pain, that is physical pain, social, psychological, and spiritual, each contributes to 25% of the pain. So if you're treating pain, chronic pain or cancer pain in a person without addressing the social, psychological, and spiritual part of the pain, you're doing injustice. Just by giving medicines, you cannot treat pain. So what is religious pain? Feeling guilty over the violation of moral codes and values of his or her religious tradition. And spiritual pain, those who have concluded through their own self-judgment that there is something wrong with them at their core. So this is again another story. And this elderly lady with this huge tumors, we ensured that she was pain-free, but still she was in suffering. And then we tried to find out the cause of her suffering. And she had an existential distress. She had cultivated a small kitchen garden. And there were a lot of vegetables growing in that kitchen garden. And in the afternoon, a lot of monkeys would come and try to steal the vegetables. So every afternoon, she would sit in the charpoy with a bunch of stones and she would drive away the monkeys. Now, her main concern was that after I die, who is going to take care of my kitchen garden, and who is going to throw stones at the monkeys? Because that little kitchen garden was her spirituality. That was what gave her a sense of meaning and purpose in her life. That was her spirituality. Right? See, you can see the kitchen garden here, right? And then we finally got her daughter-in-law and made her promise that, yes, I will take care of your garden. And only then she could finally die in peace. See, she used to sit every afternoon in front of the kitchen garden. So hope is something which we should preserve, right? But giving false hope is wrong again. So this is what patients basically need. Help me, that is, help my physical pain, physical body. Listen to me, listen to my problems, listen to my spiritual issues, psychological issues. Stay with me, do not abandon me. And after I am gone, remember me. And then this is our hospice, and this was one of our patients in our last days of life. This is our hospice in rural Jharkhand. That's about it. Thank you. And if there are any questions, I would be happy to answer them.
Thank you, sir. If anyone having any doubts, please ask in the chat box, or you can unmute yourself and ask. Also, participants can share their personal experiences.
Yeah, about that paper which somebody just asked about dreams, end of life dreams and visions. If you just Google it, end of life dreams and visions, and Indian Journal of Palliative Care, you will get it. Yeah, Mr. Palakkad, and as you said, that prayer, you used to pray, and that gave you a sense of relief after your parents died, as you mentioned. And yeah, you used religion as a way, because your spirituality was interposed with religion, and that is a very common way. And all more than 80% of the people use religion as a way of for coping to address that spiritual pain. So perfectly normal.
Is there any other doubts? Any personal experiences? We have a question in chat box. Does the eye always open up before dying? Sir?
No, not necessarily. Because dying can happen in so many different ways. You might gently slip into a coma and then die. But then I won't go into the details of this because that becomes a lecture by itself. The eyes don't necessarily have to open, but at some point before you lose your focus, the last time you open your eyes, before you finally close them or lose focus, uh, whom do you want to see or whom would you like to see? The last time your awareness, your mind is aware, the last time that your mind becomes aware, whom would you like to visualize? So that is the question, right? So, and then you gradually slip into a very gray zone about which a lot of discussions have been taken place, but nobody exactly knows what happens in those planes. So we have to be concerned with those planes where we can do something about it. So if you want to see your loved ones the last time before you finally slip into a coma or unconsciousness. So that is a choice which you can achieve.
Doctor, I have a doubt, like how do we respond to this why me question spiritually? Like the patients will be having why I got this disease, why am I like this? So how do we answer to this question spiritually?
See, all these questions, that is what I said, that there is a difference between science and what we do it here and philosophy, right? So science would have, in science, it is always about true and false. Whether you answer a question in the right fashion or not, that is about it. But when you come to philosophy and phenomenological approach, that is your lived experience, there is nothing right or wrong about it. So it could be, suppose I have a suffering and I feel that, oh, I had fought with this person or I had not looked after my parents well in the last days, and that is why I'm suffering from cancer. So this is my belief then, right? So first you need to, and every person would have their own belief, and every person would have their own reasoning about it. So first of all, the approach should be to find out that reasoning. What is the reason? Why do you consider yourself that you are suffering because of this reason? And in your whole life, have you done everything wrong? You must have done something good also. You must have done something without any expectation also. So try to find out those goods also. And then you need to sit and bargain with the patient also. Make him realize that yeah, there is evil in the world, but there is also goodness in the world, right? So it is not necessary that only evil should prevail. The balance is maintained by goodness and by evil. Both the things have to be there simultaneously, right? So it is all a matter of negotiation and how you approach good communication. And it should be culturally appropriate also, right? So this all comes through practice. And the first part of the practice is listening.
Thank you, doctor. And we have one more question. What to do when a person is diagnosed with cancer?
Okay. So what would you want if you have failed in an exam? Suppose your results have come and you failed in your exam. What would you want to do? Would you like to go back home? Once a person is diagnosed with cancer, once he gets the report from the doctor, you know how difficult it is for that person to actually go home and tell his family that, listen, my report has come and I have cancer. The same way, when you carry your mark sheet home, how difficult it is to show to your parents and tell your father, especially your father, that look, I have failed in my exams. Isn't it difficult? So, but then how do you break that news? And how do you come to terms with it? I cannot just give you a formula that A plus B is equal to C, because such a formula will only exist in science. If you apply your scientific knowledge out here, you are sure to fail. Here you need compassion, as I said, listening. When a person is suffering, what do they want? They want to unload their suffering. So you should be a compassionate listener. Please listen. If you listen carefully, 80% of the healing takes place just by compassionate listening. So listen first before advising. All of us want to give some of the great advice. Don't give any advice. Just listen to their suffering. And then the next day, perhaps again come back. Be present for that person. That is more important.
Anyone has anything to add or to ask? Okay. Thank you, doctor, for the wonderful session. It was very informative and truly an eye-opener. Thank you so much, sir.
Thank you. Thank you.
Thank you, Doctor, for the wonderful session. Thank you all for participating. Thank you, Neeraja, for the facilitation. We'll see you in the next session. Thank you.